As I work through my own issues by respecting the process. Often it's very easy for me to sort of put an outcome to the experience that I'm having, but truthfully, I have found in my own life that working through my issues really just is about honoring the moment, and not being so focused on the outcome. If the process is there, no matter what, if you have faith in it, it'll, your body and your mind will guide you to resolving the issue. I guess I decided to become a therapist because at the time that I made the transition, I was working in the funeral home as a funeral director, and I was seeing families a lot for arrangements and for directing the funerals and things like that. An ad for volunteers for the Distress Center, and I applied and they took me, and I guess that sort of just changed things for me. I found that I had a gift in listening, which is odd because people these days find it hard to, sometimes people find it hard to listen, and listening isn't really considered a gift, but when you use it in the way that I do, it changes lives. My stance on religion in therapy sessions is pretty flexible. I believe in spirituality, and I try to use a paradigm that fits with most people in their observances, whether they be Muslim or Jewish or Protestant or Catholic. It kind of doesn't matter. I've done my own spiritual work and my own work in religion that I can sort of be malleable to what is presented in front of me in regards to I help people in therapy by getting them to think about their issues in a different way. I think probably you might find a large philosophical slant to my approach, but it's one that's geared towards a real empathic curiosity around how you structure your inner world and how that inner world responds to the inner worlds of other people, and how that inner world also responds to the external world, the environment. It takes into consideration all those things, and really focuses on drawing out the strengths, not just like surface strengths, but really deep inner strengths to help position you in terms of making you aware of your own personal resources and your own level of resiliency that will help you through your confidentiality is protected here through GFC, first and foremost through the Health Protection Act, secondly through the stipulations that are placed on any registered social worker in Ontario. We follow the College Act, and the Act provides for a process that respects the confidentiality of all clients and issues and client problems. Confidentiality can't be respected, and certainly when it comes to vulnerable populations like children or older people that might be put into harm's way because of a certain issue. Well, I always try to work with the client first and get them to own the issue, and in most times if someone needs to be alerted, I'll ask the client to do that, and I will support them in doing so. Sessions are about 50 minutes in length, but I have some people who come once every 2 weeks, and they have an hour and a half session. So it really depends on what your needs are and what your availability is. I guess, if that question came to me, I'd be saying that's probably a good reason why you're in therapy, because if you think I should know the questions you should be asking, that might be part of the problem. The one question I would probably ask you is, why don't you know? And maybe that would be part of our therapeutic problem solving, is to figure out how it is that you, when it comes to ensuring being thorough about services that you're going to be instituting for yourself. Your treatment options are plentiful. Certainly in Canada, you have access to all types of treatment options. You can see a public agency here in Kemptville, or a chance that you might not fit with the counselor. But then again, you know, your experience might be really positive, and you might develop a relationship with one of these agencies and come to really revere and respect and work with them, and that's fine too. I guess here in treatment options, I use slightly a psychodynamic approach that's informed by psychoanalytic theories around relationships. I use these primarily because they've been validated by science, in fact empirical science, neuroimaging studies that speak to how development in the brain closely adheres itself to the model of psychoanalysis. Freud wasn't too far off. In some subjects he could certainly have done a rewrite or have certainly positioned himself better, but for the most part he really changed the world when he brought forward psychoanalysis, because if you kind of look closely at a lot of treatment modalities, they refer to transference and countertransference reactions, which are not from those treatment modalities, but in fact from the theory of psychoanalysis. The charge depends on who's seeking services, so it could range differently from individual to couple to family. If you came in under an EAP provider or a referral from a third party like a ministry funding or whatnot, it really depends on what the situation is. There's always a full disclosure around fee with people, and certainly some of the things that we'll talk about. Depending upon if you're third party therapy. Yes, I've been going to therapy now for over a year, and I'm still in therapy. I go once a week for an hour, and I am in therapy in the own modality that I use with my clients, which is object relations theory. It's a branch of psychoanalytic studies, but it focuses on more of the relational aspects between me and other people. And so if you came to one of my sessions, you'd probably hear me speaking a lot about my relationships, and that's sort of the focus of the theory, and it helped me quite a bit, and I'm really happy with my therapist too.